Cynthia, thank you very much. I'm still mystified as to why you would do me the honor of allowing me to address this audience. It is daunting to follow such brilliant fellows. And I was wondering, what can I say in 10 minutes? Not that it would be easier if it was longer, but what can I say in 10 minutes to such an august audience on this issue? And I thought I would want to leave you with 3 messages. The first is that I think we are at a particularly important turning point in the sciences that are just fundamental to mental health. Now, every generation thinks it's a particularly turning point, but I would like to convince you why we might objectively be right. The second thing I would like to emphasize is what UK does particularly well in the larger international ecology of mental health sciences, because it's very important that we at least give attention to those things where we make a unique contribution. And thirdly, I want to leave you with a personal message that things do change. And Bill Gates says a very interesting thing. He says we often overestimate what will change in 2 years and underestimate what will change in 10. So I want to leave you with an example that things do change. So why do I think we're at a particularly pivotal time? And I think there's an interesting lesson to learn here from the war on cancer. The war on cancer has been going on since the Second World War. Nixon gave it a name in the 1970s, but society has been investing a lot of time in cancer money, time, energy in cancer research. But now that we know the history of it, you realize not a lot happened till the 1990s, until the technologies were right. And what that tells you is you could spend a lot of time, energy, and money, but unless you have the science and technologies right to address a question. Now, of course, it often only becomes clear in retrospect what those technologies are, but in the case of cancer, it was the full understanding of the cell division cycle and the discovery of the reverse transcriptases. Without that, you could waste your time with viral hypotheses and angiogenic hypotheses, and for 40 years not much happened. I think in mental health we have reached that time, and I would point to you that it's a convergence of 3 pivotal factors. First, the genetic basis of psychiatric disorders. In fact, it ain't simple, and there hasn't been a simple answer. But there is a complicated but real mechanism-based answer that is emerging from genetics that will be very important. It'll be important because it is something fundamental and won't get overturned in the next 3 or 5 years. It is here to stay. The second thing, I think, is the computational power. We're dealing with the brain, and I think Joshua just showed us how complex it was. And if we kept looking at it as slides or a 2x2 table, we would never really understand the complexity of what we are dealing with. So for the first time, it allows us to understand the brain the way it needs to be understood, and that is in terms of systems. So I think the increase of systems biology and a fundamental knowledge of genetics, both of which were not there 15 years ago, both of which are there now, I think fundamentally changed the course of mental health. But mind you, the cancer revolution in this regard happened in 1995. It has taken them a full 2 decades after that to really start delivering the goods. So we've got to keep the timeline right, but I have no doubt that we have reached that turning point and things are going to turn around in mental health. So what does UK do uniquely well in this ecology? And why would I make those claims? So the first thing we do uniquely well is actually neuroscience research. If you look at neuroscience citations, either by population or by population of scientists or by the amount of research money that goes into it, UK beats any other national jurisdiction. So this is why we do this well, I don't know. But for some historical reason, either because of the early scientists and victories, this is something that UK does very well. The other thing that UK does distinctively well is that we actually combine psychological and social research in psychiatry with biological research much better and much more often than anyone else. And the evidence for this is a systematic analysis of the articles published in the British Journal of Psychiatry on one hand and in the American Journal of Psychiatry over another over a period of 20 years. And it actually shows you that the perspective is different. And the third thing I think UK does particularly well is health system science. It's because we have a health system here in a way that the rest of the world doesn't. Now, many of you who are foreigners and you land at Heathrow and you look at the newspapers, the first thing you'll see is the NHS is in crisis. Look, I've been here 7 years. The NHS has always been in crisis. I think it's a bit of a British tradition to actually moan about things they love most. It is a remarkably good system. And when you look at it in another way, when you look at the Commonwealth Fund, which is a fund which monitors health in OECD countries, it actually finds that NHS gets the highest user satisfaction ratings and has the highest equity and access numbers of any healthcare system. But the important thing is that to fully grasp mental health, we will not only need brain sciences, we will not only need its link to psychological and social sciences, but we will need a systemic approach to healthcare. And I think with the databases that are now being built nationwide, with the linking of GP databases to tertiary databases, I think that's a huge opportunity in the UK. What we've not had, and I think was very well pointed out by Cynthia, and I'm not going to moan about the fact that the government doesn't invest enough in mental health. You know, no government does. Actually, that number of 5.5% that we show isn't that much different in Canada or isn't that much different in the US. What is dramatically different is the ratio of public money, public as in charitable, philanthropic money, to the governmental money. And I think that is where, despite all the good things that I've said, we have lagged behind. It isn't because there isn't a history of charity in this country. In fact, the Wellcome Trust is a remarkable example. It's the biggest by population charitable contribution anywhere in the world. It also isn't that there isn't a tradition of disease-related charities in this country. If you look at the CRUK and the British Heart Foundation, you calculate by population or GDP, they do more than the American Cancer Society fundraising or the stroke and other societies in the US. It is just about mental health. I think this was a forgotten entity. And I should further say, it isn't even that there isn't charitable support and organizations in the NGO sector for mental health. In fact, Rethink and Mind and Sane and the others have been at the forefront of this movement. There, just for some reason, has been an oversight about mental health research. And I think it's remarkable that MQ has identified it, that Wellcome has supported you to occupy this space, and I think I totally share your ambition. But as sharing that ambition, let me tell you, things do make a difference. So I joined psychiatry somewhere in the late 1980s and 1990s. I was a resident and a research fellow. And the one area that I worked in is early intervention in schizophrenia. And there are many around this room who've been in that journey. Professor Rene Khan there, Elizabeth Kuipers there, who have seen this journey for the last 20 years. But for those of you who have not, let me tell you how things do change. In 1995, if you're a young man of 20 and you start developing some odd prodromal, as we now call them, symptoms, which were probably on the trajectory towards schizophrenia, and let's say you went to your student health service, probably wouldn't get recognized for what it was. It would probably be seen as stress-related. They'd give you a benzodiazepine and send you home. You'd probably go, well, home or to your hostel dorm. You'd be there for the next 3 months, then you'd get seriously psychotic. Police would bring you to the hospital, and in all likelihood, on the very first day, you'd get 20 milligrams of haloperidol. You'd develop a dystonic reaction. You'd develop a lifelong aversion to taking this antipsychotic psychiatry stuff. But nonetheless, they would have you on a form, so they'd treat you for the next 3 weeks or so. They'd send you out, you'd be non-compliant, and there's a very high chance that you would not continue that college education. Today, in all likelihood, if that person went to the university health service, someone would have a sense that this might be, at least in the UK, I can be reasonably confident that university health services would be alert to the fact that this might be prodromal schizophrenia. They'd refer you to early intervention service, which probably in most parts of the country would see you within 2 weeks. They would likely engage you and not necessarily ply you with antipsychotics. You might still get psychotic. The rate probably conversion has not changed that much. But because it would happen in a sort of supported environment, you'd probably not be the police intervening. You probably wouldn't be in an inpatient hospitalization, and you'd probably get the equivalent of 2 milligrams of haloperidol, not 20. You'd likely not have that extrapyramidal side effect. Now, you might have a bit of weight gain. That's another story. Nothing is perfect. And there is a much higher likelihood that you would continue that university education. This is a dramatically different picture. In fact, this is a much bigger change in picture in schizophrenia, early schizophrenia, than there has been in lung cancer in the last 20 years. Now, there are some other cancers that have changed, but I've chosen a comparator of a different kind. So I think this does make a difference. And every little element of this that I pointed out, antipsychotics going from 20 to 2, increased use of psychological services, different approaches in the healthcare services, were all because someone did research. That's telling me my time is done. Is all because oh, sorry, I have to totally sign in and say cancel. Yes. So it's all because research was done by someone somewhere and then put together in a healthcare system to deliver the change. So I hope I leave you with a sense that we are at a pivotal time, that UK has unique contributions to make, and change does happen. Thank you, MQ.